Here are 15 Puerto Rico Medical Board-style clinical vignettes focused on special senses, eye disorders, and ENT pathologies, each with 4 answer choices and explanations. Special senses clinical vignettes, eye disorders, and ENT pathologies. Ophthalmology. 1. Acute angle closure glaucoma emergency treatment. A 60-year-old woman presents with sudden onset eye pain, blurred vision, headache, and nausea. Exam reveals a mid-dilated, non-reactive pupil, and IOP is 45 mm. What is the best initial treatment? A. Timolol plus acetazolamide pilocarpine. B. High-dose IV corticosteroids. C. Atropine eye drops. D. Observation and follow-up. Answer A. Timolol plus acetazolamide pilocarpine. Explanation: acute angle closure glaucoma is an emergency requiring IOP reduction with beta blockers, carbonic anhydrase inhibitors, and miotics. 2. Retinal detachment, urgent intervention. A 55-year-old man reports flashes of light, floaters, and a curtain-like loss of vision in his left eye. What is the best next step? A. Immediate ophthalmology consultation for surgery. B. Start IV methylprednisolone. C. Reassure the patient. Symptoms will resolve. Topical antibiotics. Answer: A. Immediate ophthalmology consultation for surgery. Explanation: retinal detachment requires urgent surgical intervention to prevent permanent vision loss. MASHA 3 cataracts. Characteristic finding. A 70-year-old woman complains of gradually worsening vision, difficulty driving at night, and glare from headlights. Fundoscopy shows lens opacities. What is the most likely diagnosis? A. Cataracts. B. Macular degeneration. C. Glaucoma. D. Optic neuritis. Answer: Explanation: cataracts cause progressive vision loss with lens opacities and glare sensitivity. Central retinal artery occlusion, emergency management. A 65-year-old man presents with sudden, painless monocular blindness. Fundoscopy shows a pale retina with a cherry red spot. What is the best initial treatment? A. Ocular massage and IV acetazolamide. B. IV corticosteroids. C. IV heparin. D. Laser therapy. Answer A. Ocular massage and IV acetazolamide. Explanation: CIRO is an ophthalmic emergency requiring IOP reduction and massage to restore blood flow. Age-related macular degeneration classic finding. A 75-year-old man reports progressive central vision loss. Fundoscopy shows drusen deposits. What is the most likely diagnosis? A. Age-related macular degeneration. B. Glaucoma. C. Diabetic retinopathy. D. Optic neuritis. Answer A. Age-related macular degeneration. Explanation: AMD causes central vision loss with drusen in the dry form and neovascularization in the wet form. 6. Acute otitis media, first-line treatment. A 3-year-old boy presents with fever, ear pain, and bulging tympanic membrane. What is the best initial treatment? A. Amoxicillin. B. Erythromycin. C. Topical ciprofloxacin. D. Antihistamine. Answer A. Amoxicillin. Explanation: acute otitis media is treated with amoxicillin. Macrolides are used for penicillin allergies. Chronic otitis media, likely pathogen. A 40-year-old man has persistent ear discharge for 3 months and a perforated tympanic membrane. What is the most likely organism? A. Pseudomonas aeruginosa. B. Streptococcus pneumoniae. C. Haemophilus influenzae. D. Moraxella catarrhalis. Answer: A. Pseudomonas aeruginosa. Explanation: chronic otitis media is often caused by Pseudomonas and requires topical fluoroquinolones. 8. Vestibular neuritis, diagnostic test. A 45-year-old woman has acute vertigo, nausea, and imbalance, but no hearing loss. The head thrust test is positive. What is the most likely diagnosis? A. Vestibular neuritis. B. Meniere's disease. C. Benign paroxysmal positional vertigo, BPPV. D. Answer A. Vestibular neuritis. Explanation: vestibular neuritis presents with acute vertigo and a positive head thrust test. Meniere's disease treatment. A 50-year-old man has recurrent episodes of vertigo, tinnitus, and fluctuating hearing loss. What is the best long-term treatment? A. Low-sodium diet and diuretics. B. Meclizine PRN. C. Surgical intervention. D. Oral corticosteroids. Answer: A. Low-sodium diet and diuretics. Explanation: Meniere's disease is managed with salt restriction and diuretics to reduce endolymphatic pressure. 10. BPPV confirmatory test. A 32-year-old woman has brief episodes of vertigo triggered by head movement. What test confirms the diagnosis? A. Dix-Hallpike maneuver. B. Romberg test. C. Head thrust test. D. MRI brain. Answer: Dix-Hallpike maneuver. Explanation: BPPV is diagnosed by positional vertigo and a positive Dix-Hallpike test. 11. Allergic rhinitis. First-line treatment. A 25-year-old woman has sneezing, rhinorrhea, and nasal congestion worsened by dust and pollen. What is the first-line treatment? A. Intranasal corticosteroids. B. Antihistamines. C. Montelukast. D. Nasal decongestants. Answer A. Intranasal corticosteroids. Explanation: intranasal corticosteroids are the most effective treatment for allergic rhinitis. 12. Sinusitis. Indications for antibiotics. A 40-year-old woman has nasal congestion and facial pain for 2 weeks with purulent nasal discharge. When should antibiotics be given? A. Symptoms lasting 10 days. B. Fever present at any time. C. Symptoms lasting 3 days. D. Clear nasal discharge. Answer A. Symptoms lasting 10 days. Explanation: bacterial sinusitis is treated if symptoms persist 10 days or worsen after improvement. 13. Epistaxis. First-line treatment. A 17-year-old boy has a nosebleed from the Kieselbach plexus. What is the first-line treatment? A. Nasal compression and oxymetazoline. B. Cauterization. C. Nasal packing. D. Surgery. Answer: nasal compression and oxymetazoline. Explanation: most anterior epistaxis is treated with compression and vasoconstrictors.